Hi guys, my name's Evelyn Villa and I will be doing my presentation on Del Morse and the New York State measles outbreaks. This is found in Moments in Leadership in Chapter 8. So let's get started. Some background information on this case is that Dr. Morse investigated a measles outbreak in school children in the cities of Dutchess and Ulster, New York. He was working with the New York State Health Department, otherwise known as the NYSHD. So Dr. Morse and his team at the CDC were very confused about this problem because the children were supposed to be completely or well immunized before they even enrolled in school. So seeing someone with this disease was something weird for them because everyone is required to get this measles vaccination before they enroll. So the team had questions like how long ago were the students immunized, how many doses did they receive, where they got their vaccines, and who these students were. After an epidemiological research study showed that no vaccine providers were directly correlated with the measles outbreak, that left three potential variables that were associated with the outbreak. Those were the number of immunizations received, age in months at the time of the immunization, and the time interval since the last immunization. So the current situation then was that there was a measles outbreak in two specific cities in New York, and it was, like I stated before, a very confusing situation because they were supposed to be immunized before enrolling in school. One of the strengths, but that could also be a weakness at the same time, is that the measles vaccine was already required for every child that was enrolled in school. So a strength is that it was already proving successful with those who didn't have measles. But a weakness is that the vaccine was obviously faulty in some way. The opportunity that arose from this case is that they already knew the vaccine was successful to some point, but they just needed to up the dose so when they had enough data to back them up. There aren't any threats that I heard of with this vaccine. Most worked with the CDC and the ACIP, looking at data that determined whether a second dose of measles vaccine was necessary. So that was their mission statement. They wanted to up the dose to see if that was what was necessary for no measles outbreaks at all. So the core issues were that during the 1970s, the ACIP concluded that one dose of the measles vaccine for children 12 to 15 months should be required nationally. So that's what they said before, one dose. And this was supposed to provide a 95% immunization with the herd community. So with this one dose, it should have created a herd community where it would have been hard for others to get the measles infection. The main concern was that since the US is constantly having people from different countries who aren't immunized coming in, it would eventually break the 95% immunization herd if the single dose policy continued. So just like being constantly exposed to people who haven't had the vaccine and are in the country, that was like the biggest concern. By 1989, there were at least 18,000 cases of measles across the US. These outbreaks included 21 colleges and high schools. So there aren't really other alternatives to this solution. The solution is simple, that the dose of this vaccine should just be twice. According to the CDC, the first dose should be given from 12 to 15 months and the second from 4 to 6 years of age. Like I said, there are no alternatives to avoiding this disease that are known of at the moment. Being that the vaccine is available to everyone, that's the solution for it. The recommendations are simple. Every child should get their measles vaccination at the required age. If there's people who haven't received the vaccination, they're also able to receive it at a later age. This vaccine is required in order to enroll a child in school, so there's basically no way of getting out of it. Making this a requirement in the school system creates a herd community, and it prevents further measles outbreaks. So the action plan is that in June of 1989, the New York State Legislature required all of the children enrolling in kindergarten to get the double dose of the measles vaccine. This requirement took effect until August of 1990, and it gave people enough time to become immunized. College students had until August 1991 to become immunized. The ACIP finally published its recommendation nationwide for 2 doses of the measles vaccines. After 10 years of its first being brought up, and just 8 months after New York made it a requirement. So after 8 months of New York saying that they were gonna do the double dose requirement, that's when the ACIP finally recommended this a nationwide requirement. So in my opinion, this took at least 10 years for the double dose to become approved, but now there's no country that doesn't ask for 2 doses of it. I thought this was a very interesting case because it shows how data and epidemiology go hand in hand in shaping policy. Like Dr. Morse said, the aggressive approach that the New York State Legislature took was very admiring